Welcome back, everybody. Africa's leading research, development and innovation organization, the Council for Scientific and Industrial Research, or the CSIR, which has been running now for 75 years, has made many major inventions for South Africa in terms of technology and science. But during this crucial time of the coronavirus pandemic, the Institute has been tasked with collating information and predicting trends or modeling of the virus. To tell us a little bit more about this, we're joined now by the Chief Executive Director of the CSIR, Dr. Thulani Dlamini. Dr. Dlamini, great to have you. Welcome to Morning Live.
Thank you very much, Leanne. Thanks for having us.
The work that the CSIR does is absolutely incredible, and we've covered it many times here on the show. But this has been a very different year, no doubt, for the CSIR. As we heard, always going ahead, doing technological developments, but data modeling, having a look at this pandemic here in South Africa, has this taken a lot of your time and a key focus in terms of research at the Institute?
Well, indeed, SIR had to, as part of our mandate, respond to the impact of COVID-19. I think as our mandate expects us to do, our work must contribute towards improving the quality of life of the people of South Africa. And true to that, we have had to mobilize a significant amount of resources within the organization to support the national response. And I think the unique feature that we have as an organization is the multidisciplinary capability that we're able to bring to bear to address a variety of issues. I think the one issue that you spoke to is the work that we are doing in terms of the data center that we have created within the CSIR. I think as the President mentioned in April, the CSIR has played a pivotal role in terms of supporting decision support within various parts of government to ensure that the decisions that are taken are informed by data. And I think we've been very, very active in terms of this particular responsibility that we have. But beyond that, we've also been involved in a number of other innovations. We've been, for instance, working with our partners. We've developed a local ventilator, and we've produced a few thousand of these ventilators, which have been rolled out now to various hospitals within South Africa to support the efforts of our National Department of Health. We've also been working in terms of the development of therapy, looking at various drugs that can be used as treatment for the coronavirus. Also looking at issues of the environmental impact of COVID-19, looking at issues of the presence of the virus in water, in wastewater, but also the impact of lockdown on air pollution. So there's a variety of things that we've been doing as a CSIR because of the nature of the capabilities that we have to support the national response to COVID-19. And as you say, we've had to mobilize a significant amount of resources in the organization to do this work.
No doubt, no doubt. Let's begin. Let's have a look at some of the work in a bit more detail. The data you use to map where key hotspot areas are for COVID-19 in South Africa, what are the trends looking like right now?
So this is a model that we've developed with the National Department of Health to ensure that when government responds, we are able to take into account the local dynamics within that particular community so that the response speaks to the specific issues of the ground, on the ground. So this looks at issues of vulnerability within the various communities that we've had to map as part of this mapping exercise that we undertook. So it looks at issues of income, it looks at issues of the availability of resources such as water and sanitation, so that the response then speaks to these dynamics.
I mean, we look at what the CSIR has done. You've explained it to us, whether it be working on ventilators, whether it be testing, because I believe that the CSIR has actually been working on testing. I think to date you've done over 18,000 COVID-19 tests to boost the country's capacity. How do you work with the Department of Health with this regard?
So this is work that we've been doing with the National Health Laboratory Services, the NHLS, to try and support the NHLS in terms of increasing the capacity that is available in the country for COVID-19 testing. But beyond that, we've also been doing work to support the private sector, as well as some of the state-owned entities in terms of their own testing requirements. So we have an agreement with the NHLS in terms of providing this as a service to the NHLS, but also we are contracted by private sector and SOEs to support them in terms of their own testing needs.
Now, we're looking obviously around the world, and we take cue. And one of the things that a lot of medical professionals speak to is the fact that South Africa did have time on its side. Is that when it hit in, whether it be China, whether it went into Europe or the United States, we were still watching, we were learning, we were hopefully preparing. I mean, obviously, South Africa's infection rate is still very, very high, and it's not going down, because we're still seeing that infection rate of anywhere from 2,000 down, and that's something we need to be aware of. But let's look and talk to second waves, because we're seeing a lot of countries around the world now suddenly experiencing second waves, some worse than the first wave. Any of your research and your collation allow you to predict if, in fact, South Africa will see a second wave?
We are doing some work in that regard in partnership with the Statistician General as well as the National Department of Health, in terms of trying to understand the triggers of the second wave. Because depending on how society responds to the restrictions that have been placed with regards to mobility, that becomes a critical factor in terms of what the triggers are for the second wave. For instance, we are seeing that in a number of European countries, the opening up of social activities such as restaurants and so on and so forth has been a critical factor. But in South Africa, we don't know what this will be. It could be the opening up of our broader transport sector, for instance, which could be a contributing factor. We don't know yet. And we are doing a lot of research in terms of trying to collect data, both in terms of what has happened in other countries, but also in terms of the impact of the lifting of the restrictions on various social as well as economic issues.
I mean, I'm reading a study at the moment by Wits University suggesting that COVID-19 virus might start following a seasonal cycle just like the flu, and that we will see this second wave. But as you say, it is so unpredictable, and you just are still every day discovering more and more about this. Now, the one thing that you were quite vocal about, quite good at, and that, of course, at the beginning of the coronavirus, we spoke to the CSIR about their role in providing those rapid test kits. How did that come along? Where are we with this, and some of the breakthroughs that have been developed when it comes to testing for the virus?
So we are still continuing with that research. It's work which is still evolving. It's a PCR-based technique that we've developed for the rapid detection of the coronavirus. We are not yet at a point where we can say we have a product that we can roll out to the general public. So the research continues, but we are very optimistic that we'll be able to make a significant breakthrough in terms of the development of this technology. I think, as you say, we anticipate that this virus is going to be with us for quite some time to come. And therefore, any innovation that we are working on today will certainly be very helpful in terms of dealing with the pandemic in the future.
There's a lot of concern and people a bit worried about the fact that South Africa might not be doing enough testing. We've obviously seen the amount of tests being done in the country drop dramatically, and whether or not that's because the demand is not there, or if it's due to the fact that we don't have sufficient capacity to test, is, you know, we need to still ascertain which side of the story is actually true. From the CSIR, though, do you have the capacity to assist if, in fact, there is a much bigger demand that we can actually reach?
Most definitely, most definitely. I think we've been working with the South African Development Bank, as well as other private sector entities who have invested in the infrastructure that we have created within the CSIR to do testing. I think at this point in time, we're able to test up to 25,000 samples per week, which is a significant amount of capacity that we've created within the organization. Of course, there are limitations in terms of what one can do, from the test kits themselves to the available infrastructure. And hence, I think it was perhaps prudent for the country to develop a testing strategy that responds to the capacity that we have on the ground. But I'm certain, and I have no doubt, that if there was a bigger demand than what we are doing today, the CSIR will be able to respond to that.
It's good news, because I mean, if we look at the numbers yesterday, and I'm just putting up what it was that we tested yesterday. I mean, out of all of the infections that were reported, we'd only done 10,000 tests. That's 10,714 tests, and of those, the reported numbers that came back were 926. So we need to keep that in perspective. We really do. These are the numbers that were released by the Health Department yesterday. So we certainly aren't out of the woods, and that testing capacity and story is still something we need to keep a very close eye on, because 10,000, many would argue, is really not enough. We need to do more. I want to quickly go back, because I know we don't have too much time, but the issue of ventilators, and at one point when things were really dire around the world, it was the shortage of ventilators that came up as a major problem. At the beginning of the interview, you spoke about how the CSIR, with local partners, manufactured over 7,000 ventilators to deal with COVID-19. Are you still manufacturing these ventilators? Is this sort of making us ready if in fact that second wave does come, that we will have these ventilators available to South Africans?
No, certainly. I think we have a target of producing 28,000 ventilators for the country. And we are working very hard to get to that by the end of this month.
Good.
Continuing.
Yeah.
And it certainly, of course, will make a significant impact in terms of our ability to treat those cases which require ventilation.
I want to also just leave coronavirus for a moment, and also focus on the fact that 75 years of the CSIR doing phenomenal work. I mean, this is something that we need to be very, very proud of, because if we look back over the years and the things that the CSIR have actually accomplished and what you've done, and also the face of science in South Africa, over the years there haven't been very many black scientists in South Africa, and transformation is something I know that is key when it comes to the agenda of the CSIR. How are you looking? What would you count as some of the major accomplishments over these years that the CSIR has achieved?
So there are many things to be proud of, and I think those of us who are part of this organization at this point feel very privileged to be part of an organization like the CSIR. I think if one looks, for instance, at our contributions in terms of human capital development, I think we can say that we've made quite a significant mark with regards to that, in terms of the development of scientists and engineers and leaders. They've gone on to achieve great things within South Africa and abroad. In addition to that, I think we've been able to build a very strong infrastructure base for research, development, and innovation within the CSIR, but also the infrastructure which we make available to our partners in academia as well as in the private sector. I think here we can speak of the advances we've made in terms of infrastructure for advanced materials research, in aeronautics, in biorefinery, as well as in biotechnology, to name just a few. But also, we've developed world-leading innovations. I think you spoke to this earlier. And here, I think one can speak of innovations in the transport sector. I think the heavy vehicle simulator, which we developed in the 60s, has become a critical technology that is used in terms of accelerated pavement testing across the world. I mean, we licensed this technology to various parts of the world, in Asia, in North and South America, and also within Africa and Europe. If you also look at our innovations in defense, in the energy sector, in advanced materials, the CSIR has developed the largest 3D printer in the world, and we are now in the process of utilizing this technology. But also the role that we play in terms of supporting a capable state. And here one can speak of the work that we did with the National Department of Home Affairs with regards to the development of the South African smart card. I think the smart card that you and I use today was developed by the CSIR. The security of the smart card and the design features of the smart card were developed by the CSIR. Amazing. We've also, over the period between 1990 and 2014, span of over 54 companies. And the survival rate of this is currently sitting at 31%, which is a big achievement from an organization like the CSIR.
Thank you for talking to us. Congratulations to all of you at the CSIR. Keep on doing the fabulous work. And I mean, that 3D printing is something that is certainly very, very exciting. And we look forward to seeing some of the new innovations that you come up with. I mean, 3D printing of body parts and things like that. It's amazing. We need to come visit you soon. CSIR CEO Dr. Thulani Dlamini, thanks for talking to us about their collating, gathering data on COVID-19, the work they've been doing for COVID-19 together with the Department of Health, some of the predictions, and of course, celebrating 75 years of existence. So thanks again, Dr. Dlamini. All right, almost time to say